Hi, and welcome to the informational video series on the rules for certified child care centers. This is a video number 4 covering staff records, children records, parental permissions, and program records. My name is Carrie Hudspeth. I work for the Child Care Licensing Division as a regional manager in the Salem Field Unit. The Child Care Licensing Division hopes that you find these videos informative and supportive in learning about the new Certified Child Care Center rule set. During each video in the series, we will explain some of the key features and highlights of the Certified Center rules. Another new aspect is that the rules have been organized differently to help make information easier to find. While we are highlighting many key features, changes, and new rules throughout this video series, the entire rule set will not be reviewed. Please refer to the Certified Child Care Center Rulebook for the full list of requirements and rules. Okay, let's get started. First, we will review staff records and training requirements. A certified child care center must maintain current personnel records for each staff in paper or electronic format, which include name, address, and telephone number, job title and duties, dates of first and last days on the job, emergency contact information, evidence of education and qualifying work experience showing that the person meets the qualifications for the position, and the Central Background Registry, CBR, confirmation letter sent from Child Care Licensing Division, CCLD, to a center. Additionally, staff records must include current first aid and CPR training certificate, current food handler certification, if applicable, driving record, driver's license number, and expiration date if the person is to transport children, evidence of participation in an orientation, and a statement signed and dated by the employee showing they have access to the center's policies and the rules for the certification of child care centers. If a certified child care center does not yet have a Central Background Registry, CBR, confirmation letter for staff, they must have written documentation that the center has verified with Child Care Licensing Division that the staff is conditionally or actively enrolled in the CBR and that they are linked to the center. This can be done by calling or emailing our customer service staff or your licensing specialist. Documentation must include the date, time, and the name of the CCLD staff member that the center spoke with. Pictured on the right is a document that is available on the Department of Early Learning and Care website or from your licensing specialist. It is not required but can be used to help ensure that you have all the required documentation for each staff. Next, we will review requirements for children's records. A certified child care center must obtain enrollment information for each child in paper or electronic format prior to the first day of attendance. This includes date the child entered care, name and contact information of the person to be contacted in an emergency if a parent guardian cannot be reached, the name and telephone number of the school that a child attends if applicable, authorization to obtain emergency medical care and to transport the child for emergency medical treatment, developmental and health history of any needs that could affect the child's participation in the program. A written care plan for any child must be readily accessible to those caring for the children with chronic health issues or special care needs such as allergies, previous serious illness or injuries, and medications prescribed for continuous long-term use. There is a new requirement that a facility must have verification that parents or guardians have received a copy of the center policies. A certified child care center must ensure that all children's records are immediately accessible to program staff during hours of operation for use in an emergency or for children with chronic health issues or special care needs. Another new requirement has been added that a certified child care center must have the parent or guardian review, update, and sign or initial the enrollment form at least annually. A child's dentist information is no longer required enrollment information. This is a look at our enrollment form. They are available on the Department of Early Learning and Care website or through your licensing specialist. They have been updated to meet changes in this new rule set. A certified child care center must comply with Oregon Health Authority's administrative rules on immunization of children. Two items to note. If a child is enrolled in a public or private elementary school, immunizations are not required to be documented by the child care facility. A center may provide care for children who are in foster care or experiencing homelessness while parents, guardians are taking necessary actions to comply with immunization requirements of the center. We will now review parental permission requirements. A certified child care center must have permission from a parent or guardian for authorizing the pickup of their child by a person not listed on the child's records. The documentation should be kept in the child's file and must include the following items: date and time of permission, period of time the permission is valid, name of the individual providing permission, name of the individual permitted to pick up the child, and name of the center staff receiving the permission. A certified child care center must have the following current permissions from parents or guardians when applicable: participation in any center-sponsored religious or cultural event, for any special occasions where food is served, prior to a high-risk activity such as swimming, prior to using photographs or recordings of a child publicly, for example, use in social media or advertisements. Document PR-0607 contains various parent permission forms that centers can use for these situations and events. If a family is experiencing homelessness, the center must make efforts to follow parental permissions rules. If a certified child care center is unable to acquire written parental permissions, permissions may be received verbally when documented by the certified child care center or electronically, such as through a text message or email. Next, we will review program record requirements. A certified child care center may store records off-site that are older than 1 year, but they must be made available within 48 hours upon request. A certified child care center must make all other records available to Child Care Licensing Division at all times. A certified child care center must have at least one staff member on site who can access any records that are stored in paper or electronic formats. Electronic records are permitted and must be portable for use during an emergency evacuation. If using electronic records, the center must have procedures in place to ensure prompt access, including an on or off-site electronic backup method to ensure access in the event of data loss. A certified child care center must maintain the current day's attendance record in paper or electronic format with each group of children. All caregivers must have access to the attendance records to determine which children are in care during their work shift, changes in caregivers, and emergency evacuations. A certified child care center's daily attendance records must include the child's full name and times recorded as children arrive and depart so that the record shows the children in attendance at any given time. If a group of children separates from the larger group to move to another activity, such as going outside, the responsible staff member must have a method to account for the children in the separate group, such as a written list of the children's names. Thank you for watching this video in our informational series. You can now move on to the next video in this series. If you have any questions, please contact your licensing specialist. For more information, visit our website at www.oregon.gov/DELC.